We're talking about heart healthy and having a safe and healthy ticker, right? As a fitness routine is crucial, we know, to any long-term heart health, but what about the options for those living currently with heart disease?
Yeah, there's kind of like, you're like, well, can I do anything because I have this condition, or I got, my family has this. Should I be allowed to do any exercise? So to answer that question, we welcome Dr. Nick Ruthman, who's a cardiologist at the Cleveland Clinic, knows a lot about the heart. So that's a good place to go. How you doing? Welcome, by the way.
Thank you. Thank you for having me.
So this used to be something where maybe if you spot something early in someone's life, you have to really be careful, cautious. But that's really not the case that you're finding in a lot of new research. Is that true?
It absolutely is. There are hereditary, inherited heart conditions, and historically these have kind of led to this dogma and this diagnosis of, oh, you better become sedentary, you better stay on the couch, you just better not activate and exercise your heart. But this newer revised data and studies have shown that actually more exercise and more activity is the key ingredient to actually keep these people stronger, healthier, and moving further. And when we talk about one specific inherited disease like hypertrophic cardiomyopathy, typically that has always led to this cause and concern of doing less is more, but that's starting to change.
What's the general thought behind it, the process? Is it that you need to work that muscle more to make it stronger, or is there something else that's behind it?
So in general, and I'm a little biased, but I think the heart's the most important muscle of the body, and
it's
the more that we
pretty important.
right, exactly, the more we activate it, the more that it's going to let us be there for us in times of really stress or strain. And on the flip side, if we're more sedentary, if we sort of sit on the proverbial sidelines, then we're going to come into trouble down the road. And so really to more activate, increase circulation, increase blood flow through all the pipes and veins in your heart system and your entire body, improves cardiovascular outcomes, decreases the risk factors of heart disease, decreases heart events, and overall makes you just a healthier and stronger person.
I can imagine, though, you always need to be, if you have something, in touch with your doctor. Make sure it's always monitored what you're doing and you have that communication. Also, though, this could be for athletes who are professional athletes, elite athletes. So it's not like they're saying, well, you can go for a walk 30 minutes a day. I mean, young people with this can go for it.
Absolutely.
As long as you're monitored.
Indeed. And then when it comes to the professional athlete or just someone who kind of wants to go from that couch to getting back to being active, absolutely you need to connect with a cardiologist or your health physician just to have that specific screen, especially if you have one of these inherited diseases or someone in your family has had concern of one. Very important to get checked by your cardiologist before you get back on that roadway. And when you do, just start low, go slow, and go.
Low and slow. Would there be anything that's off limits?
Really, with this new updated data, not necessarily. Now, for the extreme, elite, high-intense, vigorous, competitive sport or activity, there's still very much a case-by-case situation, and it's very individual by individual, because some of these heart conditions that are genetic inherited really occur across the entire spectrum. So not every person's created equal. So it still comes back to that individualized shared decision with your doctor. But really, we're starting to find that the more that you can do, the better for you, and some people can actually get that green light to get back on the court or the football field and be as active as they want.
That is wonderful.
Is there testing available to see if you have something like that? Because a lot of people might not know with their family history.
Right, absolutely. There is testing. You know, we don't necessarily test all comers, but if you have someone in your family that's had a heart event, they've had a horrible sudden cardiac death or a very early heart attack when they're 20, 30, 40. Those are the key signs and symptoms that, wow, maybe this is something that's genetic and I should get checked out by my doctor.
How about something if you've got something going on, or what are those symptoms or signs that people out of breath, is that, like, what should we look out for that, okay, this is more than just you're overdoing it?
Right. And I always say if you feel something, say something. So certainly if you feel that shortness of breath, you feel fatigue, chest pain obviously is the classic one.
Sure.
But even more nuanced, there's some dizzy, lightheadedness, or I feel like I might pass out but I haven't. That could be from a heart condition as well.
And it might not be.
It might not be.
But it could be.
One of many causes.
Right, for sure.
Dr. Ruthman, thank you so much.
You're very
welcome.
welcome.
Good insight.
you.
We appreciate it. Live with us from the Cleveland Clinic.
We
And
want to
again,
say
welcome to the show.
a quick hello to Olivia and Ella, who are here from the Cleveland Clinic shadowing this amazing team. And they're here visiting students. So good luck to you guys in college. Great to have them with us in studio
so much.
today.
Thank you.
Thank you. Appreciate the report.